Hello and welcome to today's Health Promotion Live webinar. Today we have Dr. Casey Chosewood, and moderating our call we have Teresa Lovely. Teresa is a business coordinator for Worksite Wellness and Development. She works for the Kentucky Department of Public Health, and she's been there for about 5 years, where she provides education and support for businesses and worksite wellness across the state. So Teresa, take it away.
Thanks, Kelly. Hello, everyone. This is Teresa, and I'm happy to introduce our speaker today, Dr. Casey Chosewood. Casey is Senior Medical Officer for Work-Life and Total Worker Health with the National Institute for Occupational Safety and Health, otherwise I think most of us know it is NIOSH. And through the Work-Life and Total Worker Health programs, Dr. Chosewood is dedicated to protecting and promoting the health and well-being of America's workers. Previously, he served as the director of CDC's Office of Health and Safety, serving 15,000 members of the CDC workforce through safety programs, occupational health, environmental protection, and health promotion programming, and prevention initiatives. Dr. Chosewood served as the medical director of CDC's 3 occupational health clinics. He received his medical degree from the Medical College of Georgia and completed his residency in family medicine at the University of Connecticut. He is assistant professor of family and community medicine at Emory University School of Medicine since 1997. So, Casey, we're glad you're here today, and we're ready to hear your presentation.
Thanks a lot, Teresa, and good day. It may be morning for some of you and afternoon for others, so good day to everyone. I hope you've had a great week and have a wonderful weekend planned. I am very excited to speak to you today about a topic that I feel very passionately about, and that's the safety, the health, and engagement of America's workers. And many of you share, I'm sure, that dedication, as well as a profound commitment to the health of the people that you serve, or that you lead, or that you work with. I know that some of you are from government, some of you are from the public sector, some from the private sector, maybe some from nonprofit organizations, but you all have one thing in common, and that is that you care about the health of the people that you work with. In the programs that you provide and in the services that you offer. And just really on behalf of CDC and NIOSH, the National Institute for Occupational Safety and Health, I want to say thank you for what you do to help protect and promote the health of Americans across our country. We're going to spend about the next 40 minutes or so talking, and then I'll be sure to save some time at the end for any questions that you may have. I'll also pause at a couple of points to send a poll your way so I can get your feedback on some of the questions that I'm interested in hearing back from you on. So we'll do those a little bit later. I must tell you, this is where I put on my dark sunglasses and say I'm from the government and I'm here to help. This is actually our disclaimer that says I may mention some organizations and commercial entities and services. Obviously, those are not endorsements by the government. We don't do that. And also, I may express some personal views and opinions here. And if you want officially cleared guidance from our agency, please go to cdc.gov. Wow, this is not a statement that you oftentimes think about when you think about the United States of America. It seems that we have a hospital on every single corner of America's cities. There's doctors' offices everywhere. You would never say that we have a shortage of health, right? I mean, it's just not part of the U.S. Paradigm. But I would suggest to you that what we have a large supply of and a large, perhaps, oversupply of is actually health care or health delivery, healthcare delivery. But I would purport that we have a shortage of true health, especially when you think about prevention. We spend a lot of money on health care, but in truth, we only spend a very, very small fraction of the nation's investment in overall health in prevention. And despite that very, very large spend, we are among those countries that don't rank well at all. We're 35th still in infant mortality in this country compared to other nations around the globe, and we're 30th in life expectancy. The average Japanese female citizen will live 9 years longer than the average male citizen of the United States. 9 years, that's a decade of lost life. So even though we spend almost twice as much as the next highest spending country on health per citizen, we do not measure up when it comes to longevity and really in the full enjoyment of health. Well, why is that? Well, we certainly still have a lot of tobacco use. We're a leading country for cancer risk. We have heart disease rates that are very high, diabetes rates that are high and rising, and we're seeing diabetes now at younger and younger ages. We still have high levels of violence-related death in this country as well as
Welcome to GoToWebinar, Web Events Made Easy.
Tobacco being number one. They're in rough rank order. Poor diet and physical activity, alcohol use, infectious agents, toxins and toxic agents, motor vehicle crashes, firearms, sexual behaviors, and drugs. So you can see that this number here of risk factors, most have a significant prevention component or the ability.
Welcome to GoToWebinar, Web Events Made Easy.
But in truth, we spend less than 4 cents of every one of those dollars on prevention and on public health. And that's despite the fact that 80% of the risk factors I just mentioned, which are the leading causes of death, are behavior related and thus very preventable. So that, I think, is an important take-home message for us if we have no other. I want you to, in each and every realm of your responsibilities and your opportunities each and every day, think, am I investing enough in my organization, in my day-to-day activities, in prevention? And you could even ask that same question in your own personal life. Do you spend as much time thinking about ways to improve, enhance, and prevent disease as in thinking about the visits to the doctor, taking your medication on the treatment side? So we, I think as a nation, need to balance that quite a bit. So if we talk just for a moment about health care, so not health in general, but just the care part, what's driving up the cost so much and so quickly? Well, clearly there's an increasing prevalence of disease. We have more people with higher rates of obesity, diabetes, and heart disease. And that's a function of both better screening programs and better diagnostic programs and diagnosing folks earlier in life. We also have continuing technological innovations, and those tend to be expensive. And that, in general, is driving up the cost of health care. Treatment lasts longer than ever before. People are going on to chronic disease management programs, regimens, medications at earlier and earlier ages. And we also believe that there's some quite inefficient delivery models, the way we deliver health care. There's a lack of good coordination between primary care and specialty care. In fact, in many populations, people have many times higher use of specialists than in others. There are marked geographic differences in the way healthcare is delivered. The best practice in one city, or the common practice, maybe I should say, in one city for the treatment of a common condition is far different and oftentimes far more expensive in another part of our country. We're also a very diverse population here. We have parts of the country that are very wealthy and have very good access to all the positive social determinants of health, and because of the market disparities in our country, we have other areas and populations that don't have access to those same high-quality communities. I would also propose there's both under and overutilization. So some folks use too many healthcare resources, and that's not to say that they're just greedy, or to say that they are oftentimes prescribed medication that might be best. They may use specialty services and have procedures more than are necessary. And there again, that really comes back. We have standards and best practices in the way we deliver health care. And clearly there is underutilization in some populations as well. There's some that don't have access to preventive health care services, don't have access to primary care providers. There are doctor shortages still in parts of our country. So those are really things that are affecting the healthcare landscape. Here's just some interesting things that I thought you might want to hear about. Between 1987 and 2005, so that's roughly half a generation, here is where healthcare utilization has significantly increased in these sort of diagnostic areas. Remember, I said it's mostly because of two things: increased utilization because of underlying higher prevalence of these conditions, and also better diagnosis and recognition of these conditions. So mental health diagnoses up 242% over that short period of time. Look at the diagnosis of hyperlipidemia, elevated blood cholesterol and lipids, up over 8 times, 860% increase in that half generation. And that's largely a recognition of the role that lipids play in early heart disease and sudden cardiac death and stroke. And so, I mean, this is an important realization, but that obviously costs money, especially when we're talking about a healthcare model as opposed to a prevention model. High blood pressure up 62%, diabetes doubled, pulmonary disease up almost double as well, and back pain far more common and more diagnosed over the past half generation. Well, here I have a question for you. If the cost of a dozen eggs were to have risen at the same rate as healthcare over the past generation, how much would that dozen of eggs cost today? I mean, most of us pay about $1 or $2 for a dozen eggs today. Let's say, compared to one generation ago, how much would a dozen eggs cost today if they had risen at the same rate as the price of healthcare? Would that dozen eggs cost $5 instead of the $2 it does now? $15? $20? Here's the answer. That dozen eggs would have cost $80.25. So obviously, the cost of healthcare is far, far outpacing other cost of living items and components in our society. And we believe that it's time to take a more strategic prevention approach, the cat in the bag and not chasing after the cat after the health cat is out of the bag. We think there should be a stronger investment in building a stronger bag, not just in hiring more cat catchers, if you will. Well, I've already mentioned some of the leading causes of death, and you know, CDC was started as an infectious disease agency, and still does a lot of remarkable work in infectious disease control. But here are the deadliest threats facing CDC today, based on the public health threats to our nation: cardiovascular disease, cancer, diabetes, and preventable injury. And you can see the risk factors for those are a host of things: streets that are not walkable, environments that do not enhance health, lower cost, poor nutrition, foods that might be available in larger quantities than our bodies need. The lower left picture is wrong on so many reasons. I mean, not only is that an environmental disaster, but obviously this person's not getting any physical activity or probably enjoyment from walking the dog. I mean, heck, even the dog doesn't look happy in this photo here. So it's pretty amazing that to see that kind of scene. And injury, if it's grandma on the scooter without her helmet, it looks like she's using it as a purse there. But clearly, those are some of the major threats that CDC is facing. And I think you will continue to see a greater investment in chronic disease prevention and health promotion in the CDC budget. I mean, clearly, we still have a large infectious disease budget, especially as it relates to immunization and as it relates to emerging infections, terrorism preparedness, and additionally to the global AIDS program. The President's Emergency Plan for AIDS Relief is a huge part of the CDC budget. But I think you'll continue to see growing investment in the chronic disease prevention side as well. If we look specifically at obesity trends among the U.S., many of you have seen these slides, and I just want to show two quick ones. This is from 1990. There again, roughly half a generation ago, there were no states in the union with obesity rates more than 20%. I want you to fast forward just to half a generation later, and we have only one state that's below 20%. So 49 of the 50 states in this short period of time now have obesity rates more than 20%, and many of them, at least a handful, have more than 30%. And this is obesity. This is body mass index over 30. If you looked at obesity and overweight trends, these numbers are far, far worse, with some states having more than 50% of their adult population being overweight or obese. I showed the picture on the left once already, and I just want to show a contrast here. If you had employees on the other side of this fence right here, and you said, I want you to take a lunch time walk, they would probably laugh you off the stage. I mean, there are so many things that say this is unsafe, it's not inviting, there are no destinations that I would want to reach on this route. But if I were to tell the employees that work in these buildings to take a walk at lunchtime, and if I told them that Path A led to a garden market every Wednesday afternoon and every Wednesday during lunch and through the evening, and if I told them they could take Path B, and this led to 3 cafes that are 1.2 miles away, 0.6 miles away, and by the way, here's a coupon. And if you took this path, it got you to the dry cleaners, so you could go pick up your dry cleaning and it would take 15 minutes. All of a sudden, the advice to take a walk at lunchtime and the integration of that advice into the person's life takes on a whole new meaning. And that's really one of the things I want to stress to you. We have to do more than just change behavior. We have to create environments and built-in incentives and reasons for people to engage in healthier activities. We'll get into that a little bit more, but here are a couple of other sort of built environment enhancements that encourage people to integrate physical activity in their day. This is a pathway to the parking deck. That's about a quarter mile away from a lot of our offices where people park on the CDC campus. This actually is a view of the CDC campus in Atlanta, our headquarters, that really gives people here is an outdoor meeting space. You have some exposure to the nice sounds of water. There's a water feature that runs and empties into this area, a lake right down here. These are a couple of other scenes from the CDC campus, and as I mentioned, this is a trail to the parking lot that's about a quarter of a mile away from most of the offices on the main campus. So if you are going to use parking on the main campus, you are going to get your workout in the morning and afternoon as you go back and forth to your car. And that this is also an interesting component of this trail, because this had some actual worker volunteer involvement in preparing it. And that was really for a couple of reasons. Not only did it provide physical activity for the people who volunteered to help out with that, but it was also significant buy-in. And that is, I think, an important component. When you're offering health opportunities, it is great to have people participate so that they feel ownership and buy-in in the activity itself. So I want to impress, I think, an important point about behavior change. I don't think that in and of itself is enough of a preventive strategy. So in your organization, I want you to think very broadly about how you can create the environments for health to evolve, and focus on those built-in automatic things, not just about trying to change behavior one individual at a time. In fact, I would say that it's unreasonable to expect people to change their behavior when the social, cultural, and physical environments around them fully conspire against them. And this is a quote from perhaps the foremost speaker on the social determinants of health, Sir Michael Marmot, that he made at a recent American Public Health Association meeting. When we look more broadly about what is health and what that means, I think we should think about that health is so much more than just the absence of disease. Health really is a currency, if you will. It is a proxy for everything in life that you want to accomplish, that you want to do, that you want to excel at, that you want to succeed in. Health is really the currency that we use
to advance the parts of our life that we want to advance. And when you look at it that way, it becomes so much more than doctor's visits and immunizations and screenings and medications. It really is a more globally integrated concept into who we are as individuals. The Chinese have a proverb that puts it this way: a man with his health has 1,000 wishes. A man without his health has only one. And I think when you think of it in that context, then I think it takes on a whole new understanding. And how we address the health of workers, I think, takes on a new understanding as well. I ask myself these questions frequently, especially when I was the Director of Health and Safety at CDC and responsible for programs that enhance the health of our workers. I also tried to integrate day in and day out components of the workplace and how we could use the normal functioning of that workplace, the built environment, the policy environment, the cafeterias, the vending, to change the nature of the experience for those workers and viewed that in the lens of health. I think it would be an ideal measure, and I would recommend that if you have control over the questions that are asked regularly of your employees, that you ask this question: does my supervisor, does my boss, does our leadership care if I am healthy or not? I would purport to you that top-performing companies and organizations have high levels of people that would say yes, based on the policies and the activities and the built environment and my space and the schedule and all of the supports that are here, my leadership does care about my health. When an organization can answer very profoundly yes to that question, I think they're achieving a significant move forward. Here's a quick view of what we consider sort of the comprehensive components of a good worksite health promotion and health protection program. Strong senior leadership commitment goes without saying. If you don't have that leadership from the top, it's hard to envision an environment where you can have health as a cornerstone of an organization. I also think it's important that worker protection and respect of workers be a significant part of any programming. Now, what does that look like? Well, it means that if you have unsafe working conditions, if there are hazards on the job that are not being managed, if there are high injury and illness rates that are above the norm for your business, that is where your first dollar needs to be invested before any program that actually seeks to add health value. Protect those workers first with high-quality occupational safety and health programs. And once that is done, once you've achieved a good level of control of those hazards, then move on to providing a variety of opportunities for health enhancement and making sure you sort of, if you build it, they will come. Offer a huge variety that piques people's interest at different ages, abilities, health levels, fitness levels, and motivations. And we'll talk about some of that as we continue the discussion today. I think programs need to be evaluated robustly to make sure that they're actually making a difference. And be willing to hit refresh often. If something's not working, change it and try again. Measure your success and keep repeating that process. We put together 20 of those, what I would say, are sentinel components of a good, high-quality health protection and health promotion program at this website. And I'll invite you to go take a look at that. I also think another way we show respect for workers as we're building these kinds of programs is to include them in the planning. Well, how does that look? It means having a committee. It means having focus groups, having surveys, having doodle polls, having a Facebook page where you invite people to request the programs they're interested in, talk about their needs, talk about their work-life balance and what resources and programs would offer them additional ways to maintain and enhance their health. I mentioned policies already, but here I want to hammer it home again. The advantage to policies is that they affect every single person in the organization. A program or behavior change activity has to affect people one by one at a time, and has to be opt-in. But policies automatically opt everyone in. So when you develop policies of any kind in your organization, whether it's specifically about health or safety or occupational medicine or not, every policy, I want you to view it through the lens of health. For example, a benefits policy or an attendance policy, a supervisory training policy. You might think on the very face of them they don't have a lot to do with health, but I would propose that they have a tremendous amount to do with the health of your workers. I also think it's important to look at policy interventions from many different angles, just like you do from programming. And here's some examples, many that we've done at CDC. We've had a tobacco-free campus for many, many years. And not only did that send a very strong statement to our workers and to the public that we care passionately about helping people break the addiction, the chronic disease that is tobacco, but it also actually had some significant decreases in the amount of smoking on our campuses. I mean, imagine a tobacco-free campus that, is the beginning of a worker's attempt to quit. I mean, hey, I've got to go 8 hours maybe, or at least 4 hours without a cigarette. Maybe I'll try that nicotine replacement gum or the patch, and I'll just use it while I'm at work. But then they see the benefits of that. Hey, I quit today for 4 hours and I made it through. Maybe tomorrow I'll try for 8 hours. And then, hey, maybe this weekend I will try it while I'm in the car with my children on our way to the soccer game. And then maybe that 3-day trip where we're going to see the family, and eventually they will have succeeded in quitting. We know that tobacco is a really difficult habit to break. The average smoker tries 6 to 8 times before they quit. A policy at your organization that says we don't smoke in our cars, in our outdoor spaces, in our buildings, it goes a long way to helping start people down the road to quitting in many instances. Policies around work and leave, flexibility, extremely important. In fact, a lot of folks really seek this out, and we'll go into more detail in just a second on this topic. Nutritious foods at meetings policy is another way you can send a strong organizational message that this is just the way we do things. Donuts are not allowed at CDC meetings. You're not going to see those routinely in any of our activities, never at a formally sponsored meeting or group activity. We have healthy transportation policies that both encourage people to take public transit, but also pay people to walk to work or bike to work. And I'll just mention quickly that's not a government benefit. It's actually through a nonprofit community organization that we've arranged that healthy transportation activity through. There's also an increasing activity around the country where companies provide employees time during work activities for wellness activities, such as screening, health coaching, even physical activity on a regular basis. And if you're interested in that, I think that there's some programs that are really succeeding by offering a trial to get people started in an exercise program. We're going to give you an hour, 2 days a week, to go to our company gym or to take a walk outside or to go biking or skating, to do some organized physical activity. And we'll let you do that on company time for the first 6 weeks or the first 2 months. And then you're sort of on your own with the help of incentivizing people to get in a routine habit for physical activity. I want to mention just a few more things about work-life balance. I think this is a very important policy area where your organization can make a profound difference in the health of your workers. Remember, we said health is about everything you want to accomplish, everything you need to accomplish to take care of your family and yourself. It's really that proxy for everything you need to do, everything you want to do, everything you hope to enjoy. Well, this is a way where companies can really assist employees down that path. Workers want and need, and they will seek out more flexibility. In fact, if you give the average worker the choice between more vacation per year and more day-to-day flexibility and when they report to work, almost all of them will say they want more flexibility. It's also easier to organize work around people than the opposite. People are hard to organize. People's behavior is hard to change. Think about the last time you tried to change the behavior of your spouse or your partner. It's hard to do. So the way we build and organize work around people so that it works better for them will actually make them produce more and be more highly performing on the job than if we're trying to force fit them into a schedule or a work space or activity that does not fit them. I'll say it again, that every workplace policy has some effect on the health and well-being of their workers. Even if it's not a health policy, I want you to take steps to make sure that every policy you put in place has a positive effect on the health of your workers and not a negative one. That will have a payoff to the bottom line of your organization. Here's a project that I really want to encourage everybody to take a look at, and it's gotten a lot of positive reaction when I've spoken on this policy around the country. And that is to develop some resource kits for your employees around critical life topic areas and critical periods in life. Why is that? Well, these are some of the sort of trigger points when people have high stress and need additional support and help. The prenatal period, the lactation period, maybe marriages, anniversaries, return to work after the birth of a child, concerns over child safety, first day of child in school, children with autism and special needs, parenting, teenagers, family wellness and nutrition, adult caregiving. That's an increasing responsibility of many American families. So I want you to think about what are ways that I could make these transition and these really difficult and high-stress periods easier for my workers. That goes a long way at helping them balance the requirements of their work and life. Here's other ways that we can build in automatically. Remember, I talked about policy being an automatic build-in for sort of incorporating health in our day-to-day lives. Well, choice architecture really is all about that approach. If you've ever seen the book Nudge, I would encourage you to read it. The subtitle is Improving Decisions About Health, Wealth, and Happiness. And it really does say that the way we provide choice opportunity in our lives, and specifically here I'm using the example in our workplaces, really does direct people toward a healthier default option. That may be the way that you place the stairwells in your new building. It may be a way that you place foods and choices in the cafeteria and in vending machines. It may be a way that you price things differentially to encourage healthier options. It may be how you incentivize certain health risk appraisals and certain activities. It may be how you provide really good benefits for the prevention services that you know your population needs to take advantage of based on maybe the health risk appraisal data that you've obtained. So there are ways that you can use information and give people choices that specifically direct them to make a healthier option. What about the built environment? Remember I said start making sure it's safe, hazard-free, that indoor air quality is good, that the ergonomics of the workspaces are good. It also should be friendly and welcoming. I mean, the majority of Americans spend most of their waking hours at work. That needs to be an environment that sends a message that your well-being is important to us as an employer and as a leader. I've already talked about that important part of employee respect and engagement, and that really is by keeping a two-way conversation going when it comes to developing programs around health. How you arrange stairs, walkways, and paths, are they safe? Are they maintained? Would someone want to actually get out and use these facilities? Are they well lit? If they're stairways, are they safe? And I'll show you some examples of that in just a second. But what about on-site food choices? Do they make eating healthy or easier? If not, do we provide a way for people to actually bring their food and store it in a clean refrigerator that's not full of nasty-looking food or that's not kept clean, well-maintained? We talked about the importance of transportation and health. What about access to nearby health clinics or access to healthcare providers? Can we provide directions, if you will, defaults that say, here are high-quality providers, here are high-quality specialists? That, I think, is going to be increasingly important as more and more of our American workers deal with chronic disease. I also think that an important component of every workplace health protection and health promotion program should address stress. Now, stress is one of those buzzwords that can mean a lot of different things. And here I'm not talking so much about the normal ups and downs that we all go through or the pressures we might feel around a deadline from time to time, because some stress is very good. It's protective. It pushes us to excel. There's some positive aspects. I'm talking about chronic stress that really drains your employees of sort of that zeal to perform. Oftentimes it can be oppressive work conditions, poor schedules, difficult rotating shifts. It can be coworkers who bully. It might be a supervisor who doesn't have good people skills and good ability to manage a workforce and keep them happy and engaged and to make them feel like they're contributing. And it also obviously can arise, stress can arise from those things that we're dealing with away from work. So I think there's a two-part solution here. But let me just ask this question to you and have you think for just a second on what you think the average workday absence rates are for employees due to stress. And this is, I think, an extremely interesting result. So on the average workday in the U.S., how many employees do you believe are absent due to stress? Well, here's the answer. An estimated 1 million workers are absent every day due to stress. That is unbelievable. I mean, job stress costs the U.S. businesses over $300 billion yearly. That's a huge financial drain on our company. And I mentioned earlier work stress versus home stress. Well, I want really for us to concentrate less on that, because whether it's home stress or work stress, that worker is still affected in the same way. And as workplace providers and interveners, we don't have a lot of control over that home stress. We do have a significant amount of control over the workplace stress. So I would say invest your dollars crafting a less stressful workplace first, and then invest your second and third dollars in building resilient workers. We want to do more than just harden the shell around our employees for self-protection. We want to actually create environments where the risk is lower to begin with. Remember, building a resilient worker is a one-by-one activity. Creating a less stressful workplace is an integrated, holistic, system-wide, policy-enhancing intervention that affects every single person who enters that space. NIOSH does a tremendous amount on occupational safety and health, and I want you to take a look at our stress page. Specifically, work organization and stress is another key component of NIOSH's work, so please take a look at that. I think there are a lot of great programs, research, and studies that can inform your own development of stress management programs. Here are just a couple of shots from the CDC fitness centers, and we really tried to make them as nice as anything that you could get commercially. The shot on the right shows folks in a group circuit training activity. It's a very popular activity where people go through an instructor-led hour-long class using a piece of equipment. It's kind of a new twist on the way that we operate our fitness center. I mentioned enhancing stairways as a way to encourage physical activity. The CDC StairWELL Project is easily reproducible, and I would invite you to do that. It's basically changing a dreary stairwell to increase its usage by paint, by nice artwork, add music in some if you'd like. We have used a variety of approaches in our stairways across many CDC campuses. We also studied to see if there is increased usage over time. So we looked at the number of people taking the stairwell before the intervention and then immediately after the intervention. And then we looked again at 6 months later to see if people were still using the stairwells more. And the answer was absolutely yes. People were using the stairwells immediately after, and that usage was maintained even over time. So it's a very low-cost but high-impact intervention. I've heard of some companies putting children's artwork in the stairwell, or having children come in and do murals, or having staff artists, sort of amateur artists, do some murals in their stairways. Here is a picture of CDC's stairwell in our main building on our main campus. You can see it's Beautiful open windows here, inviting stairwell. This goes 12 stories to the top of the building, all open in the middle. And this is the first thing you see when you enter the building. You don't see a bank of elevators. In fact, the elevators are hidden way off in the corner here. The first thing you see is an inviting, well-lit stairwell. Our next plan is to slow down these elevators so people have to wait longer to get a ride, and maybe that will encourage a few more people to take the stairs. And then lastly, I would say that we put some signage over here by the slow elevators that says no waiting, 10 feet to your left or something like that. Okay, does this look like your break room at work? Does this look like the break room that you have in your facility, old, outdated, not very attractive? Or is this more the break room that you have for your folks? Well, I'm hopeful that this represents what your break room looks like. I mean, if you think about it, there's only one place in your whole facility that is dedicated solely and only to the worker. It's not dedicated to the customer, not to the public, but just to the worker, and that's the break room. This should be a significant area of investment for your company. Here you can see a very good view in this really neat break room. It's got the best view in the building. It really is sending a message that we care about the health of our workers. Here's just a view of some of our CDCers who are biking through communities. They're actually taking what's called a bike train, and I'll tell you a little bit more about that. Here is a shot of some of our workers who are taking a cross-country skiing outing at lunchtime in our Spokane, Washington facility. This is the bike train that I was telling you about. These folks meet in a neighborhood close to their homes, and they all get together and they ride through the busy city streets together in a pack. And this allows them to be more visible to oncoming traffic. Plus, it also provides accountability so that they're more likely to engage in an activity with a group. You can imagine one of them saying, hey, where were you this morning? You weren't on the bike train. We missed you. I want to see you there tomorrow. So we know that the social component of physical activity is important, but this is also a safer way for folks to travel to work by bike in a very busy location. Here's a view from our garden market, and I think this is one of the best interventions that we've ever done at CDC. And by the way, we have toolkits for both garden market and StairWELL projects and many of our other interventions on our website, and I'll share those resources for you at the end. But we really do believe that the farmers market is probably the most popular program that we've offered. Basically, we have a farmer and a local vendor who goes to the either farms or the local regional farmers market, loads up his truck and his trailer, and then comes to each of our campuses one day a week. So he may be at our main campus on Monday, our satellite campus on Tuesday, our downtown campus on Wednesday, and he sets up his truck and his tent and displays his wares, and people come from the buildings and buy the fruits and vegetables. We did an evaluation of this project also. We know that it increases the intake of fruits and vegetables of our workers. It costs us nothing to provide this service. It provides this man and his brother a job, a full-time job, and this is a really no cost to the government and a very helpful intervention. Here's another example of the integration of our green initiatives in our physical activity programs. We knew that a lot of people were motivated for better activity through sort of their motivation was saving the earth. They had a very strong slant towards sustainability and recycling and green purchasing. And we said, how can we use that to show people that the environment and their health are inextricably linked, that one is vital to the other? So we developed 9 working groups on 9 different topic areas that really show the connection between health and the environment. Very successful program. Many of you may have heard of the Community Guide, and if you haven't, I invite you to take a look at that. This is a joint CDC and nonprofit private sector activity, and this really summarizes what's known about the effectiveness and the economics of certain interventions to promote health and prevent disease. And they do have some specific worksite reviews that I'd like to draw your attention to. There's one on physical activity and obesity prevention. The Community Guide does recommend programs to control overweight and obesity at the worksite. They do recommend point-of-decision prompts to encourage people to use the stairs. Specifically, we recommend putting those point-of-decision prompts near the elevators. And also, they recommend creation of enhanced access to places for physical activity. The Community Guide also recommends assessment of health risk factors with feedback, but not if those things are just used alone. They only recommend it if it's used with health education, with or without other interventions. They recommend incentives and competitions to help increase smoking cessation when those are combined with additional interventions, such as quit lines, classes, support systems, nicotine replacement therapy. They also recommend smoke-free policies to reduce tobacco use among workers. And we saw that definitely make a difference in our own workforce. Here's a neat website if you haven't gone to cdc.gov/leanwork. It allows you to put in your own organization's zip code and demographics of your workers and actually calculate the cost of obesity to your work organization. And we've heard many folks use this to help motivate their leadership to intervene with some important workplace programs. And, you know, a lot of companies will say, obesity is costing us each and every year $300,000, and that's very, very likely in some organizations of a certain size. What can we do to help lower that risk? And you can say, well, we're spending that much every year on that cost of obesity. Let's take some of that money and invest upfront in programs to prevent obesity. Here are just some other examples of workplace tools and resources that are available. And then I'm going to close with just a few slides about total worker health. And remember, I titled the presentation, How Protecting and Promoting the Health of Your Employees Can Build a Culture of Wellness. Well, there's two components there, protecting and promoting. And NIOSH obviously has a long time been dedicated to the protection side. That's our bread and butter, sort of those occupational safety and health programs that keep workers safe, that lower workplace injury and illness. But we have an increasing recognition that the best worker is one whose health is optimized both on the job and off the job. And this program really recognizes that organizations can have a comprehensive strategy that integrates the traditional safety and health protection efforts with health promotion activities and other interventions to prevent illness and injury, whether it's work-related or not, so that all workers can achieve optimal levels of health and well-being. And that's really what the new program at NIOSH called Total Worker Health is about. And I would encourage each of you to visit our new website. We just launched it this week, so you're one of the first audiences that I've shared our new website with, cdc.gov/NIOSH/Total Worker Health. Here's some examples of ways programs can integrate those two things. Imagine an ergonomic consultation that also discusses the self-management of arthritis or the prevention of arthritis. Imagine a stress management effort that first seeks to diminish workplace stress and only then works on building worker resiliency. How about integrating your training and prevention programs around these common areas that affect people both at home and at work? Falls, motor vehicles, hearing loss, flexibility, safer lifting, safer travel. All of those things affect workers both on and off the risk. Imagine integrating occupational health and workplace primary care. That's an increasingly popular activity, especially in the Fortune 500, but I'm increasingly hearing about even small companies as low as 400, 500 workers now bringing primary care services onto their locations or co-opting with other small employers and developing a primary care workplace combination clinic for their workers. It's a very effective way to better manage the total health of workers. We think there's the opportunity to fully integrate the clinics in your location, behavioral health activities, traditional safety programs, your health promotion staff, your health coaches, your EAP, your disability and workers' comp, your cafeteria staff, your nutritionists, any of those ancillary programs that now work in silos, get them in the same room, get them talking together on a regular basis, and find out how you can develop synergies in each and every one of those programs. There are opportunities that are being left on the table each and every day. Our Total Worker Health program is doing research in these areas. A number of work-life centers of excellence are doing specific research around participatory ergonomics, around integrated safety and health promotion activities. I'd invite you to explore our work on our website to learn more about those. Here are the resources that I mentioned. And while you're taking a look at those, I want to send a poll out if we can do that now. And the first question I want to ask you folks is how you guys are currently, if you're currently integrating any of your traditional safety activities with health promotion programming. So I want you to take a look at the poll, and I think the poll is open. Teresa, are there any special instructions for the poll?
Oh, this is Kelly. Just go ahead and click on the answer. I'll give you a few minutes. I see some of you are answering already.
Right. And while folks are answering, I'll just quickly go through some of these resources that I would invite you to take a look at. Obviously, the main CDC and the main NIOSH pages are at the top. The NIOSH Work-Life Initiative is now the NIOSH Total Worker Health Initiative. So the website there will work as well as the one I gave you earlier. Those essential elements that I mentioned, sort of the top 20 programs that we think are essential for effective workplace programs and policies, are given there. The toolkits that we highlight here are especially helpful, and I would invite you to take a look at those, specifically around tobacco-free, around stairwells, and around garden markets. And
there's your results.
Great. Are you able to read those off for us?
Sure. We had 25% said yes, we frequently integrate programs. Another 25% occasionally integrate. 33% answered rarely, and 17% never.
Okay. So it sounds like there is some opportunity there for us to move on to better integration of these two components that are oftentimes siloed, and we're hopeful that we can move things to a more integrated approach. Because if you think of it, workers really are not one way at home and a different way at work. Each of the circumstances of home life and work life dramatically affect the opposite. So I think it's important to think about trying to integrate the total health of that worker with their work environment, with the conditions of work, with the policies in the workplace. Well, let's move on to our second poll question.
All right, it should be up there.
Okay, so the second poll question is open, and I'll let you read that to the folks.
All right, considering the total health of your workers in your organization, which of the following is your main concern or area of need?
Okay, we'll give you just a couple of seconds to answer that. Okay, and our results?
All right. There you go. We have 50% with obesity, nutrition, and physical activity, 13% workplace injury, illness, and disability, 13% chronic disease risk and management issues. Nobody answered changes in health-related benefits or access to care, and 25% workplace stress, work-life balance, and employee engagement issues.
Great. So basically, we can see the top two there, obesity and stress. And I'm 100% in agreement with you guys in picking those as certainly leading stressors and leading difficulties that we have. It's definitely a significant issue, no doubt about that. So how's our time? How are we looking on time?
We're pretty much at the end.
Okay. Great. Well, I have really enjoyed today, and I hope you folks have too. I'm sorry that we had a bit of technical difficulty. I would love for you folks to send any questions you have to me personally, and I'll be happy to answer them. So I'm happy to give you my email address here, and I'll also ask the meeting organizers to post my email address so you can send me questions if you have them. But my email address is lchosewood@cdc.gov. That's LCHOSEWOOD@cdc.gov. And I look forward to answering your questions.
All right. Well, thanks a lot, and thank you, Teresa.
And I wanted to say a special thank you to Casey for a great presentation. We appreciate your passion, your encouragement, and your practical yet really innovative ideas. So thank you, Casey.
Thanks. And I once again apologize for the brief technical problem and invite your questions in person. I'll be happy to answer them.
Well, thank you, everybody, and have a great rest of the day.
Bye-bye.
Bye-bye.